A reflection on an acute injury. I will be presenting the reflective process of an acute injury in a first aid scenario. The entirety of the presentation focuses on the use of Gibbs's reflective model, which has been effectively used to self-reflect a nosebleed incident during a university football match. Why I have used Gibbs's reflective model in comparison to other reflective models. Initially, I thought that it would be beneficial to discuss why I chose to use Gibbs's reflective model. A good reflective practice enables us to self-reflect effectively in order to critically assess one's own behaviour as a means towards developing one's own craftsmanship. Gibbs's model aids being able to critically assess in order to fully develop your knowledge and practice to excel in future situations. My initial reasoning for using Gibbs's model is that it is an easy-to-use, well-structured framework. Gibbs's model enables a thorough, in-depth self-reflection with an easy-to-follow process to allow for critical thinking. Gibbs's reflective cycle has a heavy focus on understanding emotions, with feelings and thoughts being self-reflected during the entirety of the model. By virtue of thoroughly observing emotions, the critical thinking process allows us to understand how thoughts and feelings can affect your scenario, both positively and negatively. Ultimately, Gibbs's cyclic nature allows for the endless repeated use of the model. Due to its cyclic nature, as a first aid practitioner, the opportunity to further reflection and knowledge will be ever present. Description. The first stage of the model starts with description. The simple main outcome of the description stage is to understand and describe what happened. In the 85th minute of the women's second team versus Surrey second team university football game, one of the Essex's players suffered a nosebleed. A standard coming together with an opponent was the cause of the nosebleed, although there was a level of uncertainty about what had actually gone on. The ball went out of play, then everyone went static and silent. It wasn't until I saw her holding her nose on the other side of the pitch that I realised something was wrong. As soon as I realised that blood was present, immediately I went into my first aid bag and put some gloves on. Upon reflection, this was the correct course of action to take, and I can say that the correct process was initially followed. Me and a fellow first aider were present at the incident. However, we both did not enter the field of play to deal with the incident due to the uncertainty around this situation. She was already making her way towards us on the sideline, therefore we felt that it was the best action was for us to wait and then we could deal with her after. When she came off the pitch, we got her seated so that she was comfortable and so that we could continue in our hands and had control and continued first aid. We made her tilt ever so slightly forward and we gave her tissues to deal with the blood, with the advice that she pinches at the top of her nose. After a couple of minutes, the blood from the nose had stopped. The outcome of the nosebleed was that the athlete had to come off and she had to finish the game from the sideline. I highly advised to the coach as well as the athlete that she should not continue playing due to a number of factors. I didn't think it was a viable option for her to continue playing as a result of the increased risk of the same incident reoccurring, as well as the limited time remaining. Feelings. The second stage of Gibbs's reflective cycle focuses on feelings, with the main emphasis on how did I feel and think during the scenario. When dealing with this scenario, I felt confident in my approach to safely treat the incident in the correct manner. As soon as I realised what was going on, I initially thought about how I could alleviate the pressure of the situation and get it under my control. I thought that the best way was to get her seated down and sort out her nose so that I was in control of the situation. I felt that I would be able to properly deal with this situation by calming her down. However, in this circumstance, I think it is highly important to understand the player perspective in regards to feelings. In this instant, after dealing with the nosebleed, the player insisted on coming back onto the field of play. It was clear that she thought she was capable to continue playing and had a real eagerness to continue. In regard to this, my thought process was that there was always a higher chance of the same incident reoccurring, and therefore due to the limited time left in the match versus the risk of reoccurrence, it was in the best interest of everyone that she does not come back onto the pitch. This went against her wishes, although I would not have changed my mind on this basis, and in my best interest was about her not coming back onto the same field and having the same incident. Evaluation. Moving on from feelings, evaluation reflects on the experience as a whole, focusing on positive and negatives regarding the incident. How did things go? Collectively, I can say I dealt with the scenario in a good manner, although there will be some areas where improvement can be made. I felt that I was able to deliver first aid correctly and confidently whilst ensuring that the best interests were being put into place for my athlete. I felt that it was also important to look at the reaction from the athlete as well as to evaluate my performance. Although evidently eager to return playing, her reaction after treatment was delivered was to go and get ready to play again. She would not have done this if more first aid treatment was required. As she was keen to continue, from my perspective, it was a good first aid experience. Although, to make it better, I feel that I could have personally sat her down, had a chat with her one-on-one and fully said to her that she could not have continued and got the advice from her coach to come over instead of speaking to them separately. Analysis. Now focusing on analysis, what sense can I make of the scenario? How could it have been better or worse? The situation could have gone a lot worse. For instance, if the nose did not stop bleeding and she still wanted to play. From my perspective, that would have made first aid harder to treat, as I would not have been in control of the situation as well as not being in control of the athlete. In order to have made the scenario better, I could have taken it into my own hands, and that level of uncertainty could have been dealt with. If I knew what was going on, I would have asked the referee to enter the field of play to make sure that she could have been treated from the start of the scenario. What might have helped? If I changed my angle from the sideline, I may have been able to see what was going on the pitch. When the situation first arose, I did not know what was going on. If I had moved myself alongside the touchline, maybe I could have seen a different angle and dealt with the incident at an earlier stage. What might have hindered? In this scenario, hindrance was caused by the athlete. Due to the athlete's willingness to make herself available to play again, a slight bit of hindrance and resistance was placed on myself whilst trying to deal with the incident. The athlete's main focus being that she wanted to return to play, whereas my intention was to ensure that she would be sorted and dealt with in the correct manner. Upon reflection, I still stand by my decision of advising that she does continue to not play. Conclusion. Concluding the reflective model, what else could I have done? On top of what have already been discussed, I think personally I could have introduced myself to the players. At the start of the game, I introduced myself to the relevant coaches and referees, although not to the players. If the players personally knew who I was before the game, during the game they would have been able to call for me themselves. This would have removed any waiting time or uncertainties during the match, and this is something I would follow during further matches when I am in first aid. In regard to what I have learned, the use of Gibbs's reflective model to reflect on the causes of acute injuries in sport is a process to expand knowledge in effectively dealing with fast-thinking scenarios that require first aid. I know I could have dealt with the situation quicker, although I have also learned that I dealt with the situation in the best interest of health and safety in regard to my athlete. What can I change in the future to be better equipped? If I was to make myself more known to everyone involved in the match, it would allow me to be better equipped in the sense that my first aid abilities would be available and ready to go whenever called upon. Action plan. In order to formalise my reflective practice, the focus turns to if the scenario reoccurred, how would I respond? I would react to the situation in a similar way. I would ensure that just like this incident, in future scenarios, I have full control of the situation in order to allow myself to complete first aid in the correct manner. I would approach the dealing with another athlete in the same way in regards to how I am in control. I would feel confident in ensuring that the athlete's situation would be dealt with when I'm in complete calm control. Although there was a high level of uncertainty amongst many people in the match, I was reactive when I realised the situation, albeit a bit delayed. My reactiveness to the situation is something that I would keep the same. However, in order to cast aside the uncertainty, I would approach the situation differently by asking for information from all people involved in the game. This could include other players, coaches, or the referees, as this will all be in favour of myself and the injured individual so that the response time can be quicker. Benefits of reflection. The whole idea of utilising a reflective model is so that I can benefit in the future. Reflective practice enables individuals to review and improve their own practice and has been identified as a method by which we can become effective self-directed learners. In my case, a reflective model allowed me to thoroughly self-reflect on the positive and negatives of the scenario, both of which I can learn from. From my personal experience, I know that I possibly dealt with the situation in confidence and in the correct way, although I know that I could have reduced the reaction time to dealing with the injury. Thus, if the situation arose again, I could ensure that I positively affect the scenario in the second time of dealing with it. Secondly, the model provides the opportunity for repeated use. Considering what I have learned from the reflective cycle this time, I will be able to transfer my learnings when I'm in need of self-reflecting in a different or similar manner. I can use my experience of using a reflective model as a first aider and analyse the positive and negative to ensure that my next reflective practice can be more beneficial for myself. Issues of reflection. The main issue with self-reflection is that there will always be a tendency to downplay any negatives in order to promote your experience. This is all a learning experience, so therefore you want to positive yourself, but it's also very important to add the negatives. Reflecting on a scenario, especially a first aid incident where action could have been taken in a different manner, can always be hard to process if you do not allow full transparency of the incident to be reflected on. In my case, I know that I could have dealt with the incident quicker. I would rather be done transparent with the negatives, and this will help me positively influence my actions in future scenarios. Having a biased view would only result in a higher chance of the same situation to reoccur, making the first aid experience for myself, the athletes, and many others in the game negative. References. Finally, here is the list of references that have been used during the presentation.